All right. Good afternoon, everybody. We'll go ahead and get started. My name is Jolene Conway, and I'm Senior Manager of Community Development at SonderMind. And we are thrilled to have you here for episode 1 of SonderMind's webinar series called Going There. This new web series focuses on speaking truth, sharing knowledge, and building community in this time of need. Far from just information, there's a good therapy for all of us. We are excited to support our communities over the next several weeks with these weekly virtual events on a range of supportive and exciting topics. And just a couple housekeeping items before we jump in. We will be muting our guests today and encourage you to use the Q&A section to type questions throughout, so that way we can take some time at the end to answer them. And we are recording today's webinar, but don't worry, your video is off as well. So if you're still in your PJs, no judgment there. And we'll go ahead and send you the recording after today as well, so you have it for your records. And for those that maybe want to post about this webinar on social media, use the hashtag #GoingThereWithSonderMind. So with that, I want to introduce our presenter today. I'm honored to have Dr. Shawn Emmons join us to share insight on talking to children during a time of crisis. Dr. Emmons has been a licensed psychologist for the past 20 years. Prior to her psychological career, she was a top-ranked junior tennis player nationally and internationally, later obtaining the #1 ranking for Division I tennis and earning 55th world ranking as a tennis pro. Dr. Emmons' career as a psychologist has had many facets. She has published numerous articles in peer-reviewed journals. Her private practice includes behavioral health services, sports psychology, and performance consulting. She is a proud provider and brand ambassador of SonderMind, and she continues her love for tennis as an advisor and psychological support with First Serve Tennis Foundation. Currently residing in Phoenix, Arizona, she is the mother of 2 children and loves all things sports, yoga, golf, tennis, as well as enjoying time with her friends and family. And with that, I'm going to go ahead and turn it over to Dr. Emmons.
Well, good afternoon, everyone. So, talking to children during times of crisis. This webinar is intended to provide information on how to talk to kids during times of crisis. And as we are all aware, we're in the midst of unprecedented times, a crisis as a result of the COVID-19 pandemic. The information we discuss today can be applied to any crisis situation: school shootings, death of a family member, hurricane, or a different type of crisis, such as divorce. So starting this webinar, we're going to discuss what is a crisis. And then we'll move to discussing Maslow's hierarchy of needs, in particular, the basic needs of physical, safety, security, and love and belonging. We will then move to talk about Erik Erikson's developmental stages for children, and then on to essentials of communication, and then the vital importance of self-care. And then I've provided some resources for more information and guidance, and then we'll end with a summary and then Q&A. So first, defining crisis. So a crisis can be any life event that an individual perceives as stressful to the extent normal coping mechanisms are insufficient. Also, another definition of crisis is a time of intense difficulty. Negative changes in a person's sense of safety and security. Also, conditions of instability or danger. And what's important with all of these definitions is the perception of events. So when working with children or as a parent, what's important is we get what the child's perspective is. For example, what we define a crisis may not actually be how the child perceives a crisis. So part of what we're going to discuss later is how to find out what a child's perspective is. And with all of this, opportunity to reinforce resilience. Resilience is, of course, a necessary skill in order to get through life. Life throws us curveballs, and we certainly have a big one right now. And so reinforcing these crises as a way of promoting, encouraging, and develop resilience is a way to put a positive spin on things. But it's important to meet the child at their developmental level, at their developmental stage, to know how to reinforce that resilience. So next, we're going to talk about Maslow's hierarchy of needs. So most of us, if we're therapists, have had some study of Abraham Maslow. We know that his pyramid starts with the physical and moves up to safety and security, then to love and belonging, then to esteem, and then to self-actualization. So physical needs. Basically, the physical needs have to do with they have to do with things we need to survive. For example, food, shelter, clothing. And I think, in my perspective, the physical needs, needing to satisfy those before we can move up to safety and security, kind of explains this whole toilet paper phenomenon. As we know, their stores all around the country are empty. They're empty of toilet paper as well as paper towels. And I think part of that is that in a crisis situation, people become very primal. It's an automatic for them to be able to need to make sure that their lower level needs are satisfied. And so in my perspective, part of satisfying these physical needs is making sure they have enough toilet paper. And Maslow's philosophy is that the lower levels need to be met in order to move up to the next level. So when the physical needs are satisfied, and for children, of course, food, making sure the food's readily available, having a roof over their head, making sure they have enough clothing, is going to hopefully be able to satisfy that need. And then once that need is satisfied, kids can move to wanting to have their safety and security needs met. Now, safety and security needs, a big part of creating a sense of safety and security for children, particularly in times of crisis, is to provide structure. And right now, we need to be creative because in many states, if not all, schools are shut down, and many states have these stay-at-home orders or some version of them. And so how do we create safety and security as well as structure when their normal routines are upended? Well, what we do is we present this information in a way that meets their development age, but also creating structure within this chaos. So for example, getting up at the same time every day, or making sure that food is provided at the same time every day, making sure that laundry is done at the same time. And of course, there's life, so we have to be somewhat flexible with that. But any way you can provide safety and security for kids is important. Now, in our therapeutic practice, one way we can do that is by making sure that we arrive on time, whether it's telephonically, telehealth, or if people are still meeting in person. That's a way to provide structure. In addition, it's also important that we ask kids what it is they need in order to feel safe and secure in these uncertain times. That provides structure for them. And then once the child has met those safety and security needs, then we move on to love and belonging. Now, a big part of love and belonging is feeling a connection to others. Now, how can we do that in therapy? Well, one way to do that is making sure that as much as possible, we're able to keep our appointments with them. And also, when we're in session, be emotionally present. I mean, these unprecedented times are bound to affect us as well. And so it's important for us to make sure that we keep checking to see whether what's going on in the world is affecting our ability to provide that connection that children need. And it's not only children, it's adults as well. but children have a greater need for that, possibly, because they're more vulnerable, potentially. So satisfying the physical, we can move to safety and security, and then we can move to love and belonging. And then the rest of the levels in Maslow's hierarchy of needs can also be addressed once those three are satisfied. But in times of crisis in general, people tend not to move beyond that unless there's been some sort of stabilization. So within all three, what we do is we're able to provide security and structure. All right, so next, Erik Erikson. He's a favorite of mine in terms of psychosocial development as well as a developmental psychologist. One reason why I like him is I think his stages of psychosocial development are pretty easy to use as a therapist, but also to explain to parents and sometimes to children, depending on their age. So as you can see in this graph that we're using, it talks about the first stage, which is infant to 18 months, which is trust versus mistrust. Then it moves to 18 months to 3 years, which is autonomy versus shame and doubt. 3 to 5 years is initiative versus guilt. 5 to 13 years is industry versus inferiority. And then next is identity versus role confusion. And sometimes the different stages that you see may vary a couple of years in terms of approximate age. For our purposes, we're only going to work up to this identity versus confusion, or sometimes it's called identity versus role confusion. Sometimes you'll see it 13 to 18 years, but 13 to 21 is also a range that's used. So the first stage of trust versus mistrust. In general, in this particular stage, an infant is not sure about the world and looks towards their primary caregiver for stability and security. So it can be a parent, it can be a grandparent, it can be a role model, it can be a teacher, but it also can be their therapist. Therapists provide stability, they provide security, and granted, we most likely will not see people who are infant up to 3 years, but in general, that trust versus mistrust stage also can overlap in other stages. So success at this stage can lead to hope that there are people available as sources of support. Now, one thing that Erikson talks about is that each stage has, and there's various ways that it's described, but essentially it's a developmental task that needs to be resolved. And if that developmental task is not resolved adequately, then they take that particular need to move through that developmental task to other stages. So if someone doesn't satisfy their need to have stability and security in that first stage, then they may bring it into later years as being mistrustful of other people, as well as questioning kind of their ability to be in this world. So success at each stage is really important. The second stage, autonomy versus shame and doubt. Children are focused on creating a sense of control and independence. So the developmental task at this stage, if they resolve it adequately, will lead to will, which assists in creating an internal belief of their own ability to survive in this world. So if a child does not successfully resolve this developmental task, then shame and doubt is what will come out of this. Now, of course, that's on a spectrum, and they can certainly resolve this developmental task in later years. But what we want, especially as therapists, to help create a sense that a person has control over their life to some extent. And in these unprecedented times, children feeling like they can count on their primary caregiver for stability and security, as well as having a sense of control over their environment and their ability to survive in this world. The third stage is initiative versus guilt. In this stage, children begin to assert themselves. What this looks like is we may see, in particular in our sessions, we may see kids begin to disagree with us or provide a different perspective. And it's really important to reinforce that those perspectives are their perspectives. And we're glad that they're able to let us know or be able to communicate that. At the same time, being able to at some point challenge that reality if it's not grounded in reality. Success at this stage creates a sense of purpose, which as parents or therapists, this is something that we certainly want children to have. And then inherent in this stage is reinforcing play and positive, healthy interactions with other children. So what does this mean in terms of where we are right now? And I'll talk about that more later, but just an example is to just be creative with your play. In particular, if you're a parent and you're stuck at home and you can't get out much, just reinforce any kind of play. Reinforce play with whatever toys they have available, or just reinforce some silly type of play. That'll encourage their creativity. And also, if at all possible, encourage interactions with other children. And we'll talk about that in a little bit, how to do that. So industry versus inferiority. Children begin to read and write at this stage. Teachers and peer groups become very important and are major reinforcers in a child's life. So success at this stage, or if the developmental task is adequately resolved or overcome, assist the child in developing competence and a feeling of their accomplishments. This positive reinforcement is really important. Being able to find specific details that a child is doing and reinforcing that. And detail is important. If we reinforce in terms of saying, oh, that was a good job, what we might want to add is the specifics of what that job is. For example, I really like how you created the butterfly on the paper that you're drawing. I like the detail of the purple, or how you took great care in creating the wings. So being specific and detailed and authentic is important at this stage. The last stage that we're going to talk about is identity versus confusion. Like I talked about before, sometimes it's called role confusion. In this stage, children, they're moving into adolescence and young adulthood, begin to create a sense of self, of personal identity. So the developmental task at this stage, if it's successfully resolved, will result in fidelity, which is an ability to commit to others while integrating differences. So it's important in particular right now in this, like I said before, this unprecedented crisis where life is just pretty much turned upside down, is really reinforcing in our clients or our children that you can still find ways to maintain your sense of self and to create an identity. I mean, a lot of kids these days create their identity through social media, which is still available now, but we also want to encourage some alternative ways. And we can be creative with that as well, because a big part of what we want to do is validate their ability to commit to others, which is in relationships or is in following through with what they say they're going to do, but also being able to accept people's differences. And so validation therapy is really good at this point, as well as just kind of reinforcing the positive steps someone's taking toward acknowledging that other people are different and that's okay. Okay, next we're going to talk about communication. Now, communication is really important in terms of course, anything in life, as well as in these times that we're in. And what we want to be aware of is what developmental stage our children or our clients are in. And why that's important is because we have to know how we tailor our communication. So for example, if we want to make sure that if a person is in the let's say trust versus mistrust stage, an infant, their ability to communicate is going to be different than somebody that's in a later developmental stage. And so we want to be in tune to that. But three important things in terms of communication are being available to talk. That's the first one I've identified. What's important in here is notice when children are most likely to talk. And of course, that may vary depending on their developmental stage. Bedtime, maybe one time when they're available to talk. As a therapist, maybe it's after you welcome the child or the adolescent into the session and they ease into kind of the rapport you already established, and then maybe they'll be able to open up and talk. Also during play, as we know that play is when spontaneous communication can occur. And of course, that type of communication varies based on developmental level. In this particular section of being available to talk, what's also important is to learn about their interests, as well as when initiating conversation, maybe ask the child or your client what others may be thinking about this current crisis. Instead of asking a question right off the bat, which, as we know, tends to shut people down sometimes, initiate the conversation with just asking them what other people think. Okay, listen actively. We've all learned how to, the basic concepts in listening actively. But what I wanted to emphasize here is what's really important is, regardless of the developmental stage, I mean, infants, the first stage might be a little bit difficult, but reflect back or repeat back what you heard and in the words that you heard it in. And what this does, it increases the sense of safety that you're tuned in to their needs. And this applies to us as a therapist as well as a parent or other kind of caregiver. This increases a sense of safety, like I said, that you're tuned into their needs, and let them complete their thought before responding. In times of crisis, sometimes our anxiety can be high, and that includes us, parents, caregivers, therapists, but make sure that you're really paying attention, because we tend to sometimes try to create our response while someone is still talking. So try to be really present, try to really listen, and then when your client or when your child completes their thought, then respond. What's important in this stage is also, or in this particular section of listening actively, is to stop whatever you're doing when children express concerns. So this can apply to being a therapist. This can also apply to being a caregiver. This allows the children to know that you are really paying attention. Along with this, listening actively is also listening nonverbally. Pay attention to how you're sitting, pay attention to how, whether you're looking at the clock or whether you're paying attention to your watch, but really, really pay attention nonverbally, because kids pick up on that, as we know. They may not always express it to us or communicate it to us, but they're smart. They can figure it out if we're not there 100%. And then also ask them what they need from you. And this applies as well as being a therapist, as well as a primary caregiver. Typically, they'll be able to tell you if you have rapport established, if your relationship is established, as well as if you're connected to them. All right, so being mindful. As most of us know, the mindfulness is something where we are emotionally present. And so what does that mean? So for children in particular, it means a gentle, accepting attitude for the present moment. So in this time of crisis, what I suggest is really encouraging them to, and depending on their developmental stage, accepting it as it is. Yeah, this is, you can say, yes, we're at home and this is the way it is, and we're gonna make the best of it. So attitude is really important. Of course, there are other facets of being mindful, but in general, it's radically accepting where we are, as well as just a gentle acceptance of the situation as is. That also creates a sense of security and safety in children as well as adolescents. But it also it sends the message that, hey, things are gonna be okay. And we don't know how this virus is going to pan out, but what we can do is provide skills and tools for these children to be able to manage the moment and maybe come out of this stronger and more resilient. All right. So the next section is on self-care. So self-care is what do we do for ourselves as parents and as therapists? How do we take care of ourselves so we can be mindful, we can be emotionally present, we can create a sense of safety and security, and we can be congruent with what we're working on with our clients, as well as what we're trying to teach our children. So being congruent is what we say is also what we do. So in terms of self-care, of course, at this time we have to be creative, but exercise is primary. Anything you can do to get your body moving. Yoga, jump roping, stretching, walking, of course, with social distancing, as well as social distancing when we're hiking. But like I said a minute ago, the important part of this is to just get your body moving. I was watching YouTube the other day, and they actually have some really funny videos on how people have been creative in terms of exercise in their home. So that might be a resource that you can use in terms of trying to figure out what you can do to take care of yourself, but also some ideas for what you can recommend for your clients as well as for your children. Creative socialization. Now, this social distancing, stay at home, means that we're not going to, in general, have direct contact with others. But it's really important to still maintain that connection. And what I've seen through YouTube or through social media, or also my own experience, as well as what other colleagues have told me, is that in order to maintain this socialization aspect, they've utilized FaceTime and Skype and Zoom in some different ways. For example, some people have created a happy hour through Zoom or FaceTime or Skype. I'm not advocating for drinking, but that socialization part is really important. And there's something to be said about the face-to-face contact. It's not quite the same through telephone or through text. We need that. We need that reaction. We need that connection that includes face-to-face. I also include here makeup games, and that sort of ties into exercise as well. Create your own games. For younger children, maybe the sillier the better. Older adolescents may respond differently to these made-up games, but that's part of the creative part. Be in tune to what the child needs as a therapist or as a parent, and tailor this to their developmental stage. I know that sort of the default would be to allow screen time and sort of relax rules, or as a parent, for screen time, such as my son loves Fortnite, or other video games, or the use of Instagram or Facebook. Now, I'll talk later about sleep, about why that might not be the best, but I know that the important part is for kids to continue to socialize, as well as trying to create some boundaries of what's appropriate for their developmental stage. Okay, so this next section is positivity. So how do we create positivity in the situation that we're in or in any sort of crisis? One way to do that is to reframe negative thinking. And those of us who are familiar with CBT know that identifying self-talk is a big part of that, and replacing it with something that's positive and reinforcing and reality-based. So check in with your clients, check in with your children, and determine kind of what are they thinking about what's going on. And of course, like I said earlier, target this based on their developmental stage, but use your skills, use the CBT skills that we know in terms of also identifying triggers for maybe negative thinking, and then help them create positive coping skills, and then reframe whatever they're going through in a way that's reasonable, developmentally appropriate, and positive. And what this will also do is help increase a child's sense of control over their world, as well as the fact that later in life, they're going to be able to have the skills to use if another crisis situation comes up. So another thing in this particular area of self-care is I'm a fan of DBT, and I find that this DBT can be helpful in a lot of situations, also in trying to manage crisis situations. And why I think that is because two concepts that are inherent in DBT is tolerating distress and emotional regulation. And so, of course, we're in distressing times, and as we try to create a sense of security and safety and positively reframe the situation, we need to also be aware of the fact that there's a lot of distress going on, even when we do our best to create that situation. And so, for therapists, use those skills that you know in terms of teaching your clients how to tolerate distress. Of course, as we know, that can generalize to other situations. And the other concept of emotional regulation in DBT is really important, because as we're in closer quarters, we're not able to have the release that we have been able to have in the past before this containment occurred. In general, emotions are going to typically run high. And so if we can instill in children, adolescents, clients, that they have control over how they feel and how they respond, it's going to add to the sense of security and safety that they have. All right, sleep. So sleep, yes, we all need sleep. Are we getting it? Hopefully. In times of stress, as we know, high anxiety, then sleep tends to be disrupted. And ways to kind of turn that around is to maintain a sleep schedule. Now, everybody's sleep schedule may be different, and it's important to, like when working with clients, to make sure that that's one of the first questions you ask them is, what's your sleep schedule like, and how's your sleep? And then find out how much screen time they have before bed. I just read an article today, actually, that talked about the importance of reducing screen time, in particular what they call the dark hours, because it activates the brain, and that kind of makes sense. But it's research that supports the fact that if someone has increased screen time around bed, it's likely to disrupt their sleep. So we just need to be mindful of that. Sleep hygiene involves a number of different things. Cutting off caffeine approximately around 4 p.m., depending on what time you go to bed. Making sure that you don't exercise too close to bedtime, because that sort of activates the body. And again, with all of these things, there's individual differences. So you have to apply these recommendations based on developmental stage as well as individual differences. One thing that I didn't add here under self-care, but I'm going to talk about, is nutrition. I also read another study from the Journal of the American Association of Child and Adolescent Psychiatry Connect newsletter that talked about just how important nutrition is. And in general, what that study talked about, or that paper, was that that decreasing inflammation can assist in managing chronic disease as well as major depression. And I would go so far as to also suggest that decreasing inflammation can also help in managing crises. Um, so how can we do that? Decreasing inflammation can be, like I said, nutrition, looking at what, and I'm no expert in this, this is anecdotal, but reducing our consumption of white flour, white sugar, anything that may activate our immune system. Because what we want to do is decrease, let me retract, increase inflammation, not our immune system. So anything we can do to decrease inflammation. Exercise does that, sleep, the foods we eat, in general, that can just help all around. All right, so in summary, what we've talked about today is, a crisis is an event or situation that overwhelms our ability to cope. We talked about Maslow's hierarchy of needs, how the physical needs need to be satisfied first, which then leads to our ability to satisfy our safety and security, and then love and belonging. And then we talked about Erickson's developmental stages as a guide, to target our communication based on the developmental stage. And within that is to really reinforce resilience, that our children, our clients have the ability to gain a sense of control over their environment. Communication, be available, listen actively, and be emotionally present and mindful. We talked about the different ways that we can be available, listen actively by reflecting back what you've heard and using the same words in which you heard, and then be emotionally present. Pay attention to the nonverbals, pay attention to the words that you use, really important. And then self-care. In order to be there for others, you have to be there for yourself. I know that's a concept that intellectually we know. It may be harder to implement, in particular right now during a time of crisis when we're tasked to do things that are beyond what we may have done before as parents as well as therapists. But it is important for us to pay attention to ourselves and take care of ourselves, because if we're not okay, and if we don't feel like we're taking care of ourselves, then it's going to be a lot harder for us to be able to take care of others and provide the services that our clients need. And that's vitally important, in order to do no harm, as well as to provide what it is that they're coming to us for. All right, so resources, a couple that I put up here, and of course there's just numerous resources to access, but the ones that I chose today, socialworkers.org, erickson.edu, kidsincrisis.com, adaa.org, which is the Association or American Depression and Anxiety Association, Psychology Today, psychiatry.org, which is the site for the American Psychiatric Association, ACA.org, which is the American Counseling Association, and then APA.org, which is the American Psychological Association. All right. So do we have any questions?
Thank you so much, Dr. Emmons. Yeah, if people want to jump in there on the bottom of your screen, there should be an option that is called Q&A, and that's a great place to put your questions if you have any from what Dr. Shawn Emmons presented on today. Well, definitely some really valuable things to take away from a parent perspective, a therapist perspective, and I think just overall skill base that as a human we can all hopefully lean on right now. I'll keep the Q&A box open just so people have a chance if anything comes up to jump in and do that. But just to close out on a couple different things, I wanted to share. Shawn, if you mind pulling the slides back up, and the one that has the community liaisons on it with the photos, if you want to open that up, so you can, and then you can present. Perfect. So for those that don't know who SonderMind is, we are a mental health organization that supports therapists to thrive in their private practice by taking care of some of the administrative things that a lot of us don't love, such as credentialing, billing, marketing, while simultaneously supporting clients who are seeking care. We match clients based on things like location, areas they're looking to address, payment type. So that way it's taking the burden off of the client as well. So we're currently in Colorado and Texas as well as Arizona. So we, excuse me, we have local SonderMind liaisons in each of our primary markets that will be able to just send out an email following this with the recording of this presentation, as well as your local SonderMind liaison for you to connect with. We also want to invite you to the ongoing series, as I mentioned in the beginning. We're super excited to have this be, the reality of the world we're living in right now for as long as it needs to be. SonderMind's here to support. So we'll be doing a weekly topic. So next week on April will be how to deal with the constant changes and an update with COVID-19 from an expert named Joe Smaro from San Antonio. So we'll be sure in the email that we'll send out to include the registration for that as well. And feel free to share it with your friends or anyone in the field. We definitely want to make sure that we are getting this information out there. And then as you can see in your screen, these are our wonderful community liaisons out of our Texas, Arizona, and Colorado markets. So feel free to jot down who your individual might be. Otherwise, we just really appreciate everyone taking some time out of your afternoon and jumping on, and certainly very much so appreciate Dr. Emmons' expertise today and putting this together for us. Thank you, everybody, and have a great rest of your day.
Thank you. Bye-bye.